All of our medications are kept in locked areas so that only staff can have access to them. We have a sample closet that is kept completely separate, dedicated just for samples, and it requires a card key to enter that closet. We have our narcotics locked behind a double lock box, and the keys to enter that cabinet are locked in a completely separate drawer. We also keep immunizations per the Department of Health regulations. Our adult immunizations are kept in a separate area from our Department of Health immunizations so that there's no accidental mix-up with regard to adult versus childhood immunizations. We also watch for out dates monthly, make sure that no medications are expired. We circle expiration dates on medications, preferably in red markers so that everyone can readily see expiration dates. We have multi-use vials and we date those on the day that we open them so that we know when we can no longer use that medication. Medications are dispensed per provider orders, and then we have it double checked by a buddy. There's always a buddy system. We don't ever give a medication without having one of our other support staff check it against the order to make sure we're giving the right stuff. So when we store medication to prevent medications being wasted because of outdating, we put the medications with the earlier expiration dates forward so that those medications are used first. For instance, our vaccines are kept in boxes, and we have a box that's labeled, like a little basket that's labeled 1. We pull from that box first because those are the out dates that are going to be expiring first. Those are the medications that will expire first. Medications, we look at every time we give a medication, we have to check the vaccine out date. We don't give that without checking the out date, and monthly we're required to check the medication room, the procedure rooms, all of the samples in the sample closet to make sure there's no out dates. Dispensing, we have to have an order, and either it's an order for a patient that's in the clinic right now being treated, or it's a walk-in visit by a patient who maybe gets a monthly vitamin B shot, or it's a child that needs updating on their immunization. So on those cases, we would verify with the chart. We would look at our EMR, and we would look at also the state immunization site to verify that the patient does indeed need that immunization or that medication. Every single step is important. If you leave out a step, that leaves margin for error. Check your orders, be very careful, and as long as we follow the processes in place, everything should work out just fine.